Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Beth Boynton. She's a nurse consultant and she's a pioneer in developing medical improv as a teaching modality for healthcare professionals. She's the founder of Boynton Improv Education. Today's Kevin MD article is titled Empowering Healthcare Professionals, the Art of Saying No and More. Beth, welcome back to the show.
Thanks, Kevin. It's really nice to see you. Hi, everybody.
So we'll get into your article in a little bit, but for those who didn't listen to our first episode together, just briefly share your story and journey.
Yeah, I've been a nurse for over 30 years, home health, occupational health, long-term care. Around the turn of the century, I got a master's in organization and management, which was around the same time that the Institute of Medicine was publishing a report, or the reports on the errors we were making and how they were related to communication. I started developing a consulting business to teach soft skills. And so I've been teaching and writing about and researching communication related skills for the last 20 years. That includes writing two textbooks for nurses, communication, and a co-author of complexity leadership, as well as writing the industry first book on medical info.
All right. So we're going to talk about your Kevin MD article about assertiveness. It's titled Empowering Healthcare Professionals, the Art of Saying No and More. And I think that this is very relevant because sometimes we in healthcare have trouble saying no. And I think that leads to a lot of the burnout issues that we face. How did your article come together?
Well, I think for just because I've been teaching the skills for so long and following and researching, the sentinel event data from mistakes that we make is consistently showing that the underlying problems are communication and leadership, human factors. So this ongoing, pervasive, and persistent problem with communication, and are we getting at the underlying issue? And I think part of that is that goes to some of my personal journey where learning to be an assertive person in my life and how difficult that was in healthcare. Like I started to get the skills, but boy, they're hard to practice in a culture where those skills are not supported.
So give us an example of the need for these skills for in healthcare professionals. Give us an example of how healthcare professionals sometimes have trouble saying no.
Well, I guess there's two parts to that question. An example of when we don't would be anytime we have a sentinel event and somebody didn't speak up because they had an inkling, maybe that person or patient was allergic to something, or is that the right patient to do that surgery on? They may have thought it, but they didn't have the presence and confidence to say, wait a minute, I think we're going to make a mistake here. So those are kind of like examples of what happens when you
Yeah.
don't say no from patient safety. But to your point about burnout, it's also like, if I don't say, uh, I am too tired. If I don't have the awareness to know that my own fatigue is setting in, then that's going to lead to mistake number one, but also it's going to lead to my burnout, as well as being able to see in a colleague that they may be struggling. It's like our ability to speak up for ourselves as well as support each other when we're saying, I can't do something or I need help. It's almost like there's this invisible message that you can't say that,
Yeah.
that was going to be somehow humiliating, or we'll face rejection, or we're not good enough. And it's a vicious circle.
Let's talk about those two scenarios. The first one you mentioned about speaking up when it comes to a patient safety issue. And sometimes, as you know, medicine and healthcare is very hierarchical, and people that are not higher on the hierarchy chain have trouble speaking out, or there may be implicit pressure not to speak out. Tell us how you can help those people in that scenario.
I think number one is to realize how hard it is, which just by asking the question, I think would give some sense to that. And the other thing I think would be people need to have opportunities to practice
Mm,
speaking up with their peers in a safe environment. And because that that idea of speaking up can involve some emotional risk. Um, Trying to do that in the culture with this constant, relentless, high stakes, high pressure, that's the like the last place we're going to take an emotional risk. We're going to do what's familiar, which might be freeze or shut down or run away, but it's not the way to learn how to speak up.
Now, when you say that this has to be practice, you're an improv educator. Like, do you recommend like role playing? What are some exercises that people can do to practice speaking up in those situations?
Role playing is certainly one helpful technique, and we're seeing bridges with medsim programs. I actually like to go into a deeper place with even very simple improv activities that aren't clinically based at all, that they're really just based on the actual practice of developing confidence. And because the way improv works, if I speak up in a supportive environment, I'm going to have the experience of speaking up, and I'm also going to have the experience of being heard and affirmed. And those two things help to build the self confidence and trust in with peers to take those risks.
Give us a success story where you implemented some of those techniques in a particular individual and you could really see how that changed their confidence and made them lead to perhaps speaking up in a healthcare setting. Do you have a success story that you could share with us?
Yeah, I mean, I usually get feedback. It's usually weeks or months after an event where somebody will say, "Oh, thank you so much for that Yes and training because I shared an idea in a meeting and it was heard. We're going to try it." Another example that sticks to my mind is there's an activity called Same Time Story or Story Mirror. One person tells a story and the other person tries to follow it at the same time. It's kind of hard to do and awkward at first. And I guess I don't need to go into the details, but a nurse told me after that activity that that was the first time that she ever felt heard.
Mm.
And it's like, what? Oh, wow. If she didn't feel heard, how is she ever going to be a good listener? And so to me, that was like a milestone. And another example I can think of was with a group of risk managers. And we just did this yes, but yes, and example. She has since retired, but the president at the time said, "Wow, that's why we have so many communication problems in healthcare." So the awareness that can come about, the understanding the nature of why people don't speak up is pretty powerful.
So I know that the yes and technique is a cornerstone of improv. So just for those who aren't familiar with what that is, just give us just a brief synopsis of the yes and technique.
Sure. And there's lots of different activities all based on that principle. So the yes means that you're agreeing to say yes to what your partner says. If you were to tell me that there is a plant on my head, I would say, "Yes, Kevin, I'm trying it on as a new fashion statement." So I've got a yes to that. The and was why I had plant on my head. So we have this agreement, yes, to what you said, and I'm gonna add something to it. And that seems really simple, but if we put that under the microscope, I'll try not to go too far off the track here, but the things that can be learned from yes and involve emotional intelligence, communication, teamwork, complexity, even attunement can happen with yes and activities. And we're hearing a lot about that, some of the trauma research.
So I want to get back to the second scenario that we mentioned earlier about perhaps a clinician who may be asked to do too much. You know, it could be a primary care doctor asked to participate in another after hours activity, for instance, and they may not have the assertiveness to decline that opportunity. And by saying yes to something like that, it may lead to their burnout. Tell us what kind of ways you can help that scenario in terms of declining or saying no to opportunities that potentially may be leading to burnout.
So it's actually the and part that can help us with that. We learn a lot about listening to others, and yet the and helps us to become aware of what's going on for ourselves, as well as to honor that. And so even like a very simple activity where we're naming things and a group is affirming them, we get that experience of saying something instead of freezing. So I know it's like I would like to have it be like a more switch it on and switch it off, but it's really a step in the direction of building the emotional intelligence that so people can have confidence in what they're feeling, they can identify it, and they can take the risk and say, I can't. And ultimately that gives other people a chance to say, okay, well, I could do a little bit extra this weekend. Or maybe a leader is going to say, well, you're always saying no. So that's not going to work because there's an expectation for you to be a team player. But we can have those conversations instead of these ones that lead us to end up, if we shut down, get burned out, or we get injured, or maybe we resent that we say yes, but we resent it. So then we're irritable with other people and we become more contributing to a bullying culture.
So you mentioned word culture, and I want to explore that in a little bit more depth. How much is that lack of assertiveness that sometimes occurs in healthcare professionals? How much is that associated with the culture of a particular workplace?
I think it's a very significant part of it. When I was first practicing as a nurse, I thought I was a pretty assertive person, but it didn't take me long to shut down. So, because it's sort of like getting invisible feedback. And we have cultures that will often say, well, yes, we want you to speak up for your patients or your families, but don't speak up for yourself. Don't ask for more help or more staff or, extra overtime. Those things are not encouraged, which is actually kind of a mixed message. And people will shut down. If you don't have a healthy way to communicate, then you do something else. None of the options are really healthy ones.
Now, ideally, in order to enact culture change, it will come from the top down from healthcare leadership. Are there stories where we can change cultures on an individual basis from the ground up? Have you heard stories like that?
Well, I believe in it passionately. I think that, and as one nurse or one physician, we may not be able to have a huge impact, except to say that if we decide on a limitation and leave our jobs, then we go someplace else. That's not an ideal scenario to paint. I believe that it has to happen from the bottom up and the top down. And the more, it's almost like, can we have a collective voice in healthcare without forming a union? Not that I'm not against unions. I just wish that we could have, our respected dialogues about what we need in order to do our job safely for our patients and for ourselves.
We're talking to Beth Boynton. She's a nurse consultant and she's a pioneer in developing medical improv as a teaching modality for healthcare professionals. And she's the founder of Boynton Improv Education. Today's Kevin MD article is titled Empowering Healthcare Professionals, the Art of Saying No, and More. Beth, tell us some of your take home messages that you want to leave with the Kevin MD audience.
I have three. One is that cultivating effective, respectful communication will help with every single outcome that we are trying to accomplish: safe care, healthy workforce, patient experience, and even cost effectiveness. The second lesson is that speaking up can be really hard to do. So you don't just snap your fingers and say no. People need practice opportunities to develop the skills. And third, that yes and improv activities on even a small scale can be helpful in developing those skills.
Beth, thank you so much again for coming on the show and sharing your perspective, time, and insight.
Thank you very much, Kevin.